So our study was on how home-based cardiac rehabilitation improves quality of life, aerobic capacity, and readmission rates in patients with chronic heart failure. Heart failure is a chronic condition in which the heart doesn't pump blood as well as it should, and it can result from many causes like coronary heart disease, hypertension, and unfortunately is not curable and it requires a lot of medical care. The purpose of this study was to evaluate the effects of home-based cardiac rehabilitation on the improvement of functional capacity, or VO2, and the reduction of readmission rates after 3 months of regular home rehabilitation. The subjects of this study were 75 patients randomized. The patients were taken from the general ward, intensive care unit, and outpatients. Um, these patients had either reduced ejection fraction or left ventricle ejection fraction. For the exercise training, the interventional group, which were 35 patients, were required to aerobically exercise 3 times a week for at least 30 minutes, and they had to reach at least 60 to 80% of their max heart rate. For the methods, each patient had to reach at least 12 to 13 on the Borg RPE scale. The exercise included walking, jogging, stationary cycling, and the control group maintained their normal medical care and activity levels from before, and the researchers monitored the patients through phone interviews every 2 weeks. The interventional group showed significant improvement of VO2 peak by a margin of 14.2%. The control group showed visible declines in both VO2 peak and MET. Readmission rate for patients with heart failure was 14% within 90 days. At the 3-month follow-up period, the interventional group's readmission rate decreased to an average of 5%. Of the 40 patients selected for the control group, 22 were excluded from the study due to death, failure to follow up, or incomplete data. 16 patients of the interventional group were also excluded due to inability to complete cardiac rehabilitation course, refusal of final test, or failure to follow up. In the end, the study showed that home-based cardiac rehabilitation programs can improve your aerobic capacity and lower your readmission by 10% for patients with heart failure. Home-based cardiac programs are also very convenient and acceptable alternative for patients with heart failure, since previous studies have showed that 20 to 50% of heart failure patients are not able to participate in a hospital-based cardiac rehab for at least 3 to 6 months.